It can be startling to realize that familiar tasks, like buttoning a shirt or opening a jar, have become harder than they used to be. Many people over 65 who live with rheumatoid arthritis experience just that, a steady creep of discomfort that seems to extend into every moment of daily life. Imagine being excited to fix a simple breakfast, but hesitating because of persistent pain in your fingers. Even something as routine as flipping through the morning newspaper can become a challenge. It's disheartening, to say the least, and it's all too easy to assume that this discomfort is simply part of getting older. Yet there are reasons to be hopeful. Addressing rheumatoid arthritis in your mid-60s and beyond isn't just about reducing the aches. It's about preserving your independence, your sense of purpose, and your ability to continue doing the activities you love. When it comes to rheumatoid arthritis, the stakes feel high because this condition, left unmanaged, can chip away at your quality of life. For many seniors, the real fear isn't just the pain itself, it's the possibility of losing the autonomy they've worked hard to maintain. This matters deeply because, after decades of living life on your own terms, having to rely on others for simple tasks can feel like a major loss of freedom. But there's good news. Recent developments in rheumatoid arthritis management, particularly with what doctors call DMARDs, disease-modifying anti-rheumatic drugs, are making a difference for many older adults. They can slow the progression of joint damage, potentially leading to greater mobility and a more active, fulfilling lifestyle. It's important to remember that nothing replaces personal medical advice from a qualified professional, and no single medication suits everyone. However, understanding the role of DMARDs can help you have more informed conversations with your healthcare provider. By exploring how certain approaches, lifestyle changes, tailored exercises, and mindful medication use work together, you might discover a path that helps you maintain the life you want. In the next few moments, you'll discover 4 insights that challenge common assumptions about rheumatoid arthritis and open the door to fresh possibilities. You'll meet seniors who believed they had no choice but to surrender to joint damage, only to find that there were steps, often simpler than they imagined, that could make a real difference. By the end, you'll see how taking action to address rheumatoid arthritis can support your independence more powerfully than you might have thought. Throughout this conversation, you'll hear about realistic ways to manage pain, reduce inflammation, and keep the joints as functional as possible. You'll also learn about the emotional impact, how regaining control over your body can lift your spirits and rekindle a sense of hope. This isn't about sweeping claims or immediate transformations. It's about understanding that gradual yet consistent improvements can accumulate into a remarkable change in your day-to-day life. If you've been feeling stuck or resigned to constant discomfort, stick around. By the time we wrap up, you'll have fresh insights and practical pointers that could help you live more freely, even in the face of rheumatoid arthritis. And if at any point you think of a question or feel a spark of inspiration, keep a mental note. This is your journey, and the more engaged you are, the better prepared you'll be to explore these strategies with a trusted healthcare professional. One perspective that often surprises people is how much our assumptions about normal aging can limit us when dealing with rheumatoid arthritis. There's a widely held idea that rheumatoid arthritis pain is simply an unavoidable part of reaching our later years. That once it sets in, the best we can do is grit our teeth, take a couple of over-the-counter painkillers, and hope it doesn't get worse. John, who is 70, used to hold that belief himself. He grew up watching his mother suffer from stiff, painful joints, and he assumed it was genetic destiny that he'd face the same battle in roughly the same way. When the pain in his wrist began interrupting his afternoons of gardening and tinkering with old tools, he thought it was just fate catching up to him. John's main misconception was that his escalating pain was inevitable, so he simply endured it. Yet there's a difference between commonly seen symptoms and an unchangeable fate. Evidence suggests that rheumatoid arthritis responds to a range of treatments that can slow joint damage and reduce painful flare-ups. Some DMARDs, for instance, have shown promise in lessening inflammation, and with medical oversight, they can be part of a more assertive approach to care. While John once believed that medication was only worth considering for severe cases, his rheumatologist helped him see that early use of certain DMARDs could potentially keep his symptoms from becoming severe in the first place. The shift in John's thinking began when he realized that rheumatoid arthritis isn't like typical wear and tear arthritis. It's an autoimmune condition where the body's own defenses mistakenly attack the joints. By taking a medication that modulates or suppresses certain parts of the immune response, some people experience fewer flares and slower joint damage progression. Once John understood this, he worked with his doctor to explore his options. The first couple of months were an adjustment, as he had to schedule blood tests to monitor side effects and coordinate dosing times with his other prescriptions. But within a few weeks, his morning stiffness began to fade more quickly, and he found that he could return to potting plants with less hesitation. For anyone in a similar situation, a crucial step is to talk openly with a healthcare professional about your symptoms, your daily activities, and what you value most in your life. Specific tests can determine if you're a candidate for certain DMARDs, and you may need modifications depending on kidney function, other medications, or pre-existing conditions. The key takeaway is that acknowledging rheumatoid arthritis as a genuine autoimmune challenge, and not merely an age-related nuisance, can open doors to more meaningful interventions. The emotional benefit of this mindset shift is just as important. Like John, you might find that taking a proactive stance against rheumatoid arthritis, rather than passively accepting it, restores a sense of control over your day-to-day routine. No one wants to feel like they're at the mercy of pain, and modern treatments combined with guidance from your medical team can help you reclaim some of that autonomy. Another common belief is that once a person is over 65, it's too late to embrace new therapies or lifestyle changes. Mary, who is 73, is a perfect example of why this notion isn't always accurate. She was diagnosed with rheumatoid arthritis in her late 50s and initially managed it with various pain relievers and occasional steroid shots. By the time she hit her 70s, she felt like her options were tapped out. She assumed her bones were too old to respond to anything beyond palliative care. Despite living in a bustling retirement community, Mary found herself withdrawing from events because even walking a few blocks left her exhausted and in pain. Her misconception was that her body had already passed the point of benefiting from more advanced treatments, particularly DMARDs. She thought these drugs were more appropriate for younger people who had recently been diagnosed. However, a closer look at the research and clinical guidelines shows that it's never strictly too late to consider new approaches. While older bodies may metabolize medications differently, rheumatologists often see improvement in seniors who begin DMARD therapy, even in their 70s or 80s. It all depends on proper monitoring, dose adjustments, and a careful watch for any adverse effects. Mary decided to consult a new specialist who suggested that some of her persistent pain might be due to incomplete treatment of her rheumatoid arthritis, rather than just aging. Under medical guidance, she was introduced to a low-dose DMARD tailored to her overall health profile. They started slowly, closely monitoring her progress. During the first month, she was cautious, keeping a daily journal of any side effects and noting improvements in function. Alongside this medication, her doctor recommended gentle physical therapy to strengthen the muscles around her affected joints. This multifaceted approach was a game changer. After about 3 months, Mary found she could stand from a seated position more easily and even managed a short hike with her grandson. The emotional lift was palpable. She reported feeling more confident, which motivated her to keep up with her physical therapy exercises and check in regularly with her healthcare team. The experience taught her that older adults are often more capable of adaptation than they realize. She might not feel as invincible as she did at 50, but her body was still able to respond to treatments that targeted the inflammatory process behind her arthritis. This renewed sense of capability made her feel less like a passive victim of age and more like an active agent in her own wellness. If this resonates with you, it might be worth reassessing any assumptions about too late or too old. Whether it's medication, physical therapy, or dietary changes, older bodies can still adapt under the right conditions. Talk with a healthcare provider who understands the nuances of rheumatoid arthritis and age-related concerns. Ask about the full range of treatments, including DMARDs, and be sure to mention all other prescriptions you're taking. This thorough dialogue can lead to a personalized plan that respects both your age and your desire for independence. If you find yourself intrigued by this perspective, consider sharing your questions or insights with friends or family members who might also be in the same boat. You never know. You could spark a conversation that leads someone else to seek help they didn't know was out there. One worry that holds many people back is the fear of severe side effects or dangerous drug interactions. George, 68, had heard horror stories from acquaintances about medications that caused everything from liver damage to unrelenting fatigue. While it's true that DMARDs can have side effects, like any medication, what often gets overlooked is the role of careful medical supervision. With proper monitoring, dose adjustments, and honest communication about any symptoms, side effects can often be managed or minimized. Yet the misconception that DMARDs always do more harm than good can deter people from even considering them. George was initially hesitant to add another pill to his weekly routine. He was already taking medication for high blood pressure and mild depression. The last thing he wanted was a new prescription that might complicate the mix. However, his rheumatologist explained that there are various classes of DMARDs, including conventional synthetic ones and newer biologic options. Each comes with its own potential benefits and risks. Rather than pressuring George into a quick decision, the doctor scheduled a medication review to see if any interactions were likely. They also discussed alternative dosing schedules to reduce complexity. After an in-depth conversation, George decided to trial a conventional DMARD, known for its relatively predictable side effect profile. The first few weeks required extra vigilance, including routine lab checks to monitor his blood and liver function. It wasn't always convenient, but George soon realized the benefits. His afternoon flare-ups, which used to force him to lie down and skip social activities, started to subside. He felt a new kind of steadiness, less fear that his hands would suddenly swell to the point where he couldn't button his shirt for an evening out. Crucially, George's doctor encouraged him to keep an honest record of any unusual fatigue, headaches, or stomach issues. Whenever something seemed off, they would adjust his medication schedule or temporarily lower the dose to see if he stabilized. This back-and-forth communication was vital. It allowed George to feel safe exploring a medication option that might initially have seemed too risky. Over time, as his confidence grew, he discovered an improved quality of life that made those occasional lab visits well worth it. The emotional impact of overcoming fear cannot be overstated. By confronting the possible side effects head-on and working in partnership with his medical team, George regained not just physical comfort, but also the emotional security that comes from actively managing his condition. If you relate to his story, you might think about bringing up these concerns with your doctor. Ask for a thorough medication review, especially if you're dealing with multiple prescriptions. With the right precautions, DMARDs can be a tool that helps protect your joints and your independence, while avoiding the pitfalls that worry so many people. Another angle worth exploring is how combining DMARD therapy with lifestyle changes can significantly boost independence. Harriet, at 75, found herself in a spiral of reduced mobility. She was reluctant to use any new arthritis medication, fearing it would interact with her other prescriptions for diabetes and cholesterol management. She also assumed that if she started relying on medication, exercise and nutrition wouldn't matter as much. This misconception that lifestyle changes become secondary once you have a prescription often prevents seniors from harnessing the full potential of a comprehensive treatment plan. In Harriet's case, her joints felt so stiff in the mornings that she relied on a walker to move around her apartment. She believed this was just the way her life would be, a gradual progression toward less and less mobility. However, after a candid talk with her physician, Harriet agreed to try a low-dose DMARD in tandem with a gentle exercise program specifically designed for rheumatoid arthritis sufferers. She also consulted a nutritionist to ensure her meals were rich in anti-inflammatory foods like leafy greens, berries, and certain fish high in omega-3 fatty acids. At first, Harriet wasn't convinced. The idea of planning balanced meals or doing light stretches seemed almost trivial next to the challenges of her day-to-day pain. But within a few weeks, she started noticing a difference. The DMARD helped reduce the intensity of her flare-ups, which meant she had enough energy to do her morning stretches without wincing every step of the way. As she got more comfortable with the exercises, her strength gradually improved, reducing her reliance on the walker. Meanwhile, her improved nutrition helped keep her weight under control, easing stress on her joints. One of the most significant changes Harriet experienced was emotional. For the first time in years, she felt a sense of mastery over her condition. Rather than feeling like each day was dictated by how much pain she woke up with, she began to steer the course of her own well-being. Her social life also picked up. With less discomfort, she started inviting neighbors over for tea and even joined a local senior walking club. The synergy between medication and lifestyle adjustments proved to be the linchpin in reclaiming her independence. This story underscores a vital lesson. Medication alone, while important, often works best alongside other holistic measures. Whether it's a low-impact activity like water aerobics or mindful meal planning that focuses on nutrient-dense ingredients, these lifestyle factors can reinforce the benefits of DMARDs. If you find yourself in Harriet's shoes, wondering if it's worth adding a daily walk or a new diet to your routine, the answer might be yes. Each positive change can amplify the effects of the other, offering not just reduced joint damage, but also a better overall mood and self-confidence. Perhaps now is a good moment to reflect on any small tweaks you could make in your daily routine that would support your long-term well-being. Even a short, gentle stretch first thing in the morning can become a powerful ally in your fight against rheumatoid arthritis. When you pause to think about these experiences, John's realization that RA is an autoimmune issue, Mary's discovery that it's never too late to try new treatments, George's careful approach to side effects, and Harriet's commitment to combining medication with lifestyle adjustments. It's clear there are strategies to challenge every misconception. The common thread running through these stories is the determination to preserve or regain independence. There's something deeply empowering about knowing you can still grow, adapt, and manage your condition in ways that let you keep doing what you love. The hope is that you now see how rheumatoid arthritis doesn't have to spell the end of your autonomy. While it's absolutely true that RA can cause flare-ups, fatigue, and pain, the evolving landscape of treatments and supportive practices offers a real chance at maintaining a fulfilling life. A key part of this is acting sooner rather than later. The longer you let unchecked inflammation persist, the more joint damage can accumulate. At the same time, you should never jump into any treatment without due diligence. Gather information from reputable sources, talk to healthcare professionals who understand geriatric medicine, and stay alert to how your body reacts. Remember, it's not about panic or fear. It's about urgency in a positive sense. If you've been holding off discussing new treatment options, consider scheduling a conversation with your doctor or rheumatologist soon. Bring a list of your current medications, supplements, and daily activities so you can get the most personalized advice possible. You can also share your newfound insights with someone in your circle. Not only does this help you stay accountable, but it might also encourage a friend or loved one to explore the help they need. If you'd like to get more information on managing RA, consider visiting local community health programs or attending informational sessions at nearby hospitals. If you're ready for a small but significant first step, you might try integrating a gentle stretching routine into your morning or planning a week of balanced, anti-inflammatory meals. For those who want to go further, you could explore specialized exercise classes for arthritis or schedule a deep dive consultation with a physical therapist. Each of these actions aligns with the overarching goal of preserving your independence and well-being. Ultimately, you have choices, you have options. The journey doesn't end with a rheumatoid arthritis diagnosis. In many ways, it's an invitation to learn more about how your body works and how you can continue to thrive. You've heard stories of people who found renewed energy, relief, and optimism, often by challenging long-standing assumptions. You're every bit as capable of finding a path that allows you to keep enjoying the life you've built. In the end, knowledge, determination, and the willingness to take proactive steps can be your best allies. Keep listening to your body, keep asking questions, and keep reminding yourself that your independence is worth protecting every single day.